Hi, everyone. This is Sanina Thomas. I'm one of the economic development planners within the Mayor's Office of Strategic Planning and Community Development. Welcome and thank you for joining the Mayor's Business Town Hall meeting. We're going to get started in about a minute. We're going to let a few folks continue to join our meeting. I do ask a few house rules. Just do me a favor and please make sure that you are muted throughout this presentation. And we will have moments for Q&A at the end of the presentation. This meeting is part in response to our last business town hall meeting to really dive a little deeper into the data to see what it is that the administration uses to make the decisions across the city, as well as provide a vaccine update in terms of what we're hoping to get in the next couple of months. And then we'll also provide any business related updates that we have particular to outdoor seating for restaurants. And then of course we can answer any other questions that come through. Thank you for being patient. I think we're going to go ahead and get started. So along with me, we have Kristen Salgis. She's the director of Somerset. She's going to be presenting first. We also have our COVID response team heads, Omar Bukili, Tim Snyder. We have the director of Health and Human Services, Doug Kress. We have our director of Inspectional Services, Nick Antanavica. We also have one of our communications leads, Sarah Burnt. We have economic development, my colleagues from economic development. I believe Tom Galgani is on the phone line, Nick Schomburger and Daniela Carrillo. And the mayor is going to be joining us shortly. He's tied up with another meeting, but I will certainly introduce him when he is on the call. And with that, I'm going to hand it over to Kristen Stalgis to go ahead and start us off.
Right. Hello, everyone. I'm going to go ahead and share my screen. So in my role as Somerset director and as the planning chief for our COVID team, I work with the people in the city who do our data analysis. So I will be sharing with you all some slides today to share it with some of the data that we look at across our decision making in the ICS. Okay, so when we look globally, we are at 115 million cases worldwide. This is a dashboard that Johns Hopkins University puts out, and you can see on the side, as of just in this change since from today, since February 26th, we've seen 2 million more cases, which is an increase of just about 2%. And we've had an additional 52,000 deaths, which is also right about a 2% increase since the 26th. In the US, these maps show on your left case rates. So this is cases per 100,000 residents in each of these states. And then the counts, which is just the straight number of cases. When we are looking at the US, we're seeing similar rates of change from the global case. So from the March 3rd compared to March 25th, we've had an increase in 375,836 cases, which is an increase of 1.3%. And deaths have increased by about 2.5%. So, and you can see here that there's quite a difference across the country in numbers and rates. So the spread has not been kind of even across our populations. This is a map that NPR puts out. On March 3rd, Massachusetts is counted as an orange category in terms of COVID risk level, which means our case rate is 10 to 24 daily new cases per 100,000 people. And NPR says that this notes escalating community spread. This is our first week in the orange. Last week when we looked at this, we were in the red. So that is a positive sign. When we look at data specifically within the state, you can see that we had a peak in January with a continuing a very quick increase over the fall. So you'll note that, and so confirmed cases are cases that were determined through a PCR test. Probable cases were an antigen or antibody test. That in part because of testing, but also because of the severity of our surge across the fall and winter, we had many more cases than we did in the initial spring surge. And so currently in the state, we have 545,000 cases over the life of the pandemic. And sadly, we've had 15,657 deaths. When we look at percent positivity for testing, this top line, the gray line, is positivity without our higher education institutions included. The one with 3.1% positivity most recently, and 1.9% when you factor in higher education. The reason that these two numbers are differentiated is many universities, Tufts is an example locally, where universities are testing their students and staff 2 to 3 times a week. And so these numbers are being included. These individuals who are being tested repeatedly are part of these numbers. And so they bring down our percent positivity. So when we look at 3.1, this is kind of looking at individuals who aren't participating in these large scale screening programs. And if we look at the percent positivity of just these individuals participating in these ongoing screening programs at universities, their percent positivity is 0.2%. When we look at our percent positivity over the last 14 days, although this is of February 20th, because unfortunately right now the state dashboard is down because Tableau, the system that supports their dashboard, is having issues across the board. And so that's even affecting our local dashboard, which I'll share the link for later. You'll see that there has been some pretty steep declines in percent positivity, but there's quite a large spread across our region. So Somerville here is the dash line, but some of our neighbors, are still quite a bit higher, hovering just under 5%, being Revere, Chelsea, and Everett. For Somerville, this number is 1.1% on February 13th, but on the 20th, that had decreased to 0.7% of tests over the last 2 weeks had a positive result. So every Thursday, the state publishes a public health weekly report that provides a categorization of each of the cities and how we're doing compared with 2 factors, which is what the level is based on our population, is the average cases per 100,000 residents over the last 14 days and the percent positivity. So you'll see in our area, everyone is in the yellow with the exception of Revere. Our average daily incident rate per 100,000 is at 19.3. So when we're looking at this data, these steep declines have been very positive, but we also need to understand and look at these in context. And what we're seeing in these graphs, because they're a little bit older because of this issue with the dashboard, we're starting to see that these numbers are starting to plateau. We are not continuing to decrease as fast as we have been. But this red line allows you to see, this is where we were on February 24th. The 7-day average of COVID cases in the state, we were at 1,156. That number is 7 times higher than our lowest observed value, which was from July 4th. So we are still quite above where we were at the low in the summer. And we're about the same average as we had on November 1st, which is when we were heading into the fall surge. We have something similar when we look at percent positivity, again, for the state. So as of February 24th, the 7-day average percent positivity was 1.89%. That is 2.4 times higher than our lowest observed value, which was on September 21st, and is about where we were on October 26th of this year. So again, kind of as we were heading into the fall surge. And this is hospitalizations. Where we were in the end of February was 555.8 individuals for the 7-day average. This number is still 6.2 times higher than our lowest observed value, which was in August, and is about the same as where we were on November 27th. And then finally, for this comparison, is a 7-day average of confirmed deaths. On February 24th, the 7-day average was 37.9. This is 10.2 times higher than our lowest observed value, which was in September, and is about the same average as we had on December 2nd, when we were heading well into the fall surge. One thing you may notice about this curve is that the average of deaths is way higher at the beginning in our initial surge than in the second surge, which is kind of the opposite of what we're seeing from the other graphs. And this is because as the pandemic has progressed, our medical professionals have a better understanding of how to most effectively treat individuals who have COVID, which has really brought down death rates. And so that has been one of the real successes in the pandemic, is that we've been able to bring down the death rate. But this is still quite high and much higher than anyone would like to see. So when we look at our data locally, we have updated this through March 4th. So for this, you're seeing much more up-to-date data. So this is showing our daily cases. So this is the blue lines are people who were tested through the PCR. The orange lines, which are much smaller, are the probable, which is tested through antibody and antigen testing. And so you can see again this, our local experience in the spring during the initial surge. Our case rates were actually much lower than they were in the fall surge, which we are starting to come out. And because we have the more up-to-date data, you can see where this is starting to plateau. We had this really wonderful period of decline, but now we've entered this period of plateau. And on this graph, we have this red dotted line here because our most recent data from the last about 4 days is not complete, because it sometimes can take labs a few days to get the test results in and into the Maven system. So while these last few days appear to be this continuation of the plateau, we anticipate that more cases will be added to this. It's hard to know how many, but we could be seeing an increase with the added cases. So these numbers in total have meant that 4,774 individuals have been positive via the PCR test. In Somerville, 311 individuals have been positive through probable cases, which is again the antigen or antibody tests. And we have had 74 people who are from Somerville die from COVID. And then again, to compare where we are now from where we have been, on February 28th, our 14-day average of moving cases was 15.07. The last time we were at this low was in November, and you can see that was still about as high as we were in the peak in the spring surge. Our lowest observed value for this 14-day moving average was 2, which we saw in July, which is, so where we are now is still 7.5 times higher than our lowest observed value. If you are curious and you would like to see some of this data, we update it twice a week. Unfortunately, I wanted to be able to share a screenshot with you, but because of the Tableau platform issues. I don't have an up-to-date version to share with you, but the dashboard link is below, and we would be happy to put that in the chat. And we invite you to come in and check out the data so you can keep up to date. One of the reasons why this tapering off is concerning to us is because of these variants that we are hearing about in the news. There are many, many variants of COVID. It's kind of how viruses evolve, but some of these viruses are showing to be more transmissible. And so an example of kind of impact of a more transmissible variant in a country is if we look at Brazil. So this is their 7-day average of cases over time. And you can see that they're in a period of increase again. Their variant that they're experiencing is called P1. And one of the things that has been most concerning about this P1 variant is that they are seeing that it is able to reinfect people who previously had COVID between 25% to 61% of the time. So people may end up being reinfected. One piece of good news that we're seeing is that we have the vaccine now and it's being rolled out. This rollout has been slow. As you can see from these charts from the Boston Globe, we have in hand enough vaccine in Massachusetts to vaccinate 14% of the state. But to date, we have only vaccinated 6% of individuals. So we have a long way to go before we have vaccinated all of the adults who would like to be vaccinated. One piece of good news that came out this week is that President Biden expects to have enough vaccine doses produced for all adults in the United States by the end of May. Now, this is just to have the doses in hand. It would take further time to get those doses into individual arms. And with that, I'm going to stop sharing and hand it over to Director Kress to speak more about the vaccine.
Yeah, Doug actually had to step out for an important call. So I'm going to actually hand it over to our Mayor, Joe Curtatone, who just joined us on the call, and provide us a little intro.
Yeah, so I apologize, folks. You think you have a lot of flexibility today, and Zoom calls seem to go on longer than imaginable. But right now, that's right. So I apologize for being late, and I appreciate your patience with that. So I understand going to be a lot of questions, and I always will be as accurate, straightforward, and ethical in our responses. We'll tell you what we know, tell you what we don't know, and what we can and can't do. I know the common question is, when we can expect to, given what's happened with the state and the governor's decision, and you see in other states, and that vaccines are here and open things up. I just want to be as clear as possible. We do not agree, as all experts do not agree with the governor's approach to reopening now. And the experts today are even saying, and that's to this very same question, when can we expect to open? No one can throw an accurate dot at a spinning dartboard. But the way that we're going to continue to guide us is not going to be a magic light or switch. At a minimum, we need to be able to get vaccine into the arms of our most vulnerable populations. I'm not in that category. Not necessarily me or most of you being vaccinated unless you have one of those conditions. But there are people in our community, as we know, across the Commonwealth and the country, who are suffering and dying, getting sick and dying at higher rates than all of us. Those folks need to be able to get vaccinated. And we need to see alongside that what happens with these variants, which are present in Massachusetts. And most experts are projecting, we'll know by mid-April. I hope these trends are good. It is positive news, it is a downward trend, but let's put into context of where we've been before. It's great now we have another vaccine product coming out, and we should be really excited. We have a president who's being bold and setting bold thresholds, and I feel really good that we should all that we're going to get the necessary allotments and supply to distribute. What we should be very vigilant and have a heightened attention to is where these variants go, and does the Commonwealth get to act together, because we still don't have a distribution plan for vaccine. We are still relying on mass sites, vaccination sites. The Commonwealth and the governor set aside decades of planning based on emergency preparedness plans and municipal experience in flu vaccination, and we're trying to correct that. Hopefully that gets done, because when it gets here, because I would tell you, if we had an extra 1 million doses today, we'd still be falling over each other, not getting enough people, especially those who needed more vaccinated fast enough. Our goal as municipal leaders across the Commonwealth is to make sure we execute a plan lockstep and heal with one another. We know how to do this. So that is happening, and I'll just say, and I'm hopeful, and I'll hope that that goes in the right direction, because the vaccines will get here. But even today, as we've been speaking, an announcement came out that even the Fenway site, which if you have to take public transportation, if you're one of those vulnerable populations in Somerville, don't have a car, and get on the public transportation system, that you have to, it'll take you over an hour to get there because they cut the service, stand in line for a long period of time, that's being closed. And now those same folks will have to go farther away to Heinz Auditorium. So our concern is to make sure that there is actual equitable access to the vaccines when they get here. We're not going to, the supply issue is a federal issue, but that will be solved. So one, when and how fast can we get people vaccinated is most importantly a priority, not necessarily everybody in Somerville, but the most vulnerable in our populations. Because you know the neighborhoods, we've shown you the heat maps where people are getting crushed far harder than the rest of us on this. And then secondly, all eyes on where are we? And a lot of experts are pointing to mid-April. Where's this trajectory go? Hopefully plummeting down. And we're going to continue to gauge on that and heed that advice in the hopes that we'll be able to tell you, okay, here's what we're hitting for, and here's how we're going to open up. I think it'd be disingenuous of us to tell you anything otherwise, and that's where we're at. So I apologize, I jumped in late, and I'm going to let the rest of the presentation go forth and take on any question and answer. Thanks.
Thank you, Mayor. Doug, just checking if you're back with us. I don't think he is. So while we wait for him, if there's any questions related to what Kristen just provided or what the mayor just spoke to.
I don't know if Doug was going to mention the regional proposal we put forward. I can at least give that brief context if that's what he was going to say.
Yes, I think that would be great. That, in fact, that's the call that he's on right now.
Some of you have asked and said in the public has, well, there's some of them going to get a mass site. No, what we had always said going back in November to the administration is utilize the local experience and capacity, because we know where our residents are, where they live, the most vulnerable, and leverage your resources to allocate who needs it more somewhere else. In combination with the mass sites, they do serve a purpose, but the people who are, again, the most vulnerable folks don't have equal access to that site or equitable access to that site. However, even in the Commonwealth's approach, where they're now encouraging regional collaboration, which we've been advocating for along with every municipality and local board of health for the last several months, we've submitted a proposal in this region that will service not just Somerville, but Cambridge and Arlington. Tell me if I missed any songs. Cambridge, Arlington, Medford, I believe Everett, Chelsea, Revere, and Winthrop to the Commonwealth under the framework that they most recently, in response to public outcry and municipal concerns. And that's under evaluation right now. Doug, I hopefully jumped off to get an answer on that we will still be subject to the amount of supply they give us, okay? So we understand that. And as supply ramps up, we'll tell you, we can get, here's how much of the plan we can execute. But we have submitted a plan based on those guidelines. But we are receiving vaccines right now for those housed in public senior housing buildings. So I think he would have touched on that. He probably would have added more, but at least want you to know that we have submitted in that and that within that framework and waiting word on it.
Thank you. While we wait for him, we did receive a question from Jack Connolly related to events. When will Little League, recreation, men's and women's basketball, etc., be allowed to take place? Can permitting begin this summer and fall?
Yeah.
And then, what about events like Art Bead and Hongfex? What do we?
Good questions. I am dying for an event every day. I don't know about you people, every goddamn day, and we can come up with new ones. But on the youth sports and athletics, I'd submit we're still following the same guidelines in place. They are not prohibited. We're glad we're able to work with the other communities on scholastic sports within the Greater Boston League. Jack knows this league well. We're reconstituting it. That is starting under certain protocols, especially with outside activities. We can do a lot there. So that I'd submit is going to happen. We'll reissue the guidelines on that, and they could evolve, hopefully for the better, depending on what happens in the next 30 days. So there's no plans not to have those right now, but we'll communicate that back out to the public. On the big events, I am not going to, at this time last year, maybe a couple of weeks after, you recall, we canceled everything in the summer and obviously to the end of the calendar year. I just mentioned to my staff now, we are not canceling anything at this time. I do not expect to hold events right now before June 1. However, if an event, what I'm asking us to do, and we haven't done this officially, what we're going to see what we can do and work with all of you and our community and the arts councils, if we are, depending where the, where the trajectory is, and we just pick a date near the beginning of summer and the spring, and we work after that, an event like, I don't know, take Porch Fest, which would happen before June 1. Can we have that? But what would it look like later in the summer or the fall and so forth? I want, if we can, do it safely, and if it allows, do all these events this year, but not be, and if it happens, not say, well, we usually do it in the spring, not happen. How can we do it in the fall and work with everyone to do that? So we haven't begun that yet. We're going to come back to you with that. OPI right now, I have no intention of canceling that. We will, when we do this, we need to give ourselves enough runway. And Jack has been around, and all of you in planning and participating in these events. Some of them take months in advance. So the conversation we haven't begun that will begin is to ask, working with all the different groups who plan this, is how much runway do we need? So if we push it back beyond the traditional date with the hopes that we have it, that we have a go, no go date on it. So at this point, I'm going to keep our fingers crossed that we can restart planning these. And last year around this time, a couple of weeks later into the month, we knew everything is going to be gone for the whole year. We are not there at this point, and I'm not going to do that right now unless, I'm not going to say things go in some direction we couldn't even expect. Okay. So let's keep our fingers crossed on that.
Thank you. There was a question about, will Somerville be allowing outdoor performances if the current numbers stay constant? What are the numbers that would make the city feel comfortable matching the state's reopening stage?
Yeah. I'm not going to match it. I'd be more constructive if you ask me. I'm just going to match the state's reopening phase, because I don't know the context behind what they do, and nobody does. And I'd submit to you all what I know. They know where the clusters are occurring and what activity, and they're completely ignoring them because they believe we can just hospitalize everyone who's ill. The problem with that is more people get sick that we could have avoided, and more people have died that we could have avoided. That being said, we're examining all that. Outdoor performances as well, but not large crowd gathering events. We haven't come to any determination how to do that. We're going to work with you to see what we can safely do now, especially on the outdoor stuff. I'd submit we might be able to do some things. So we're going to be able to put a little some creativity to that. But I'm not just going to accept what the state says, because it's just baffling at points. But I think I'd submit, based on what we're seeing and what we're hearing from our officials and the people who have given us input and their guidance, that we may be able to do some things, but we are not going to do anything that gathers large events, as I mentioned, to these bigger events we're used to, large gatherings, excuse me, until we are clear in a variety of goals around vaccinations and the trajectory of the virus, the variants is very, very clear to us. So more to come on that. I don't know if George and Tom, any of you have any else on that point, because we did talk about this.
Yeah, thanks. That question was from Zach Baum from Bow Market. There's also an active working group that'll be having this conversation around performers tomorrow with the Arts Council, Greg Jenkins. So if you are interested to be a part of that conversation, I certainly would encourage you guys to contact Greg Jenkins with the Arts Council.
Bottom line is we're planning for these things that we've lost last year. The question is at what capacity, when, and some of the other activities, even though we would do them before the date I picked, and there's no science behind that date, I would admit that, we're just thinking out loud, what is the, at what level are we talking about? We have to think about that and be creative. So if there's anything positive, no, we're not going to say no to everything right now. We want to be smart in planning and make it very clear. There are a lot of contingencies. I just want to be ethical and clear. And if those go the right way, we're on our way to a better place, but there's a long way to go. But I'm not being pessimistic. I just want to be cautiously optimistic with an underscore on cautiously.
Thank you. We had a question about, is there any chance that dining capacity will increase to 40% by April?
Can't answer that question. Right now, I would say no. If you want an answer today, I want to be honest. Indoor dining is a higher risk activity. The Commonwealth knows the cluster study. They haven't released it. It is, and all the experts are saying that. We are concerned, again, where this trajectory of how prevalent are these variants of coronavirus? Where does that intersect with vaccines, especially on the most vulnerable population? Where are we by mid-April? We will continue to monitor that real time. And once we feel it's safe, again, it's a spinning dot board, and I couldn't tell you where the dot would land on what number.
Thank you. We have a question from Adrian Thompson. Adrian, I'm going to unmute you, or I believe you can unmute yourself now. Sorry, Adrian, you're muted.
Sorry, I unmuted myself while you unmuted me. Good afternoon, Mr. Mayor. Thank you for pulling this call together. Greatly appreciate it. Kristen, thanks for taking us through the data. There's a couple of points I'd like to address if you'll indulge me for a few minutes. First and foremost, appreciate obviously the sharing of the data for sure. Obviously the dashboards shared today are something that we all have access to on a regular basis. Something we don't have access to is the thinking and discussions within the administration about where the data needs to get to inform the various stages of reopening. So the first part of my question is, can you divulge in a little more detail where each of the metrics, or what the key metrics are and where you want them to get to in order to ease some of the restrictions you have in place? As an example, I know that Somerville is obviously taking a more cautious approach in terms of moving towards step 2 and obviously phase 4. There are other cities and municipalities that are doing something similar, if we take Boston as an example. However, Boston has in certain situations allowed increases in capacity and certain activities to open, whereas Somerville has stayed firm with a limited and blanketed approach to phase 3, step 1. So I'd like to know first and foremost, what are the data points and where do they need to get to in order for the city to move forward? Where do you see us moving forward to next, and at what point can we expect that update? And when do you envisage the city moving into a full phase 3, step 1 that will allow currently shuttered businesses such as movie theatres to reopen, and for those of us with incredibly heavy capacity restrictions to have some of those eased? I don't expect them necessarily to fall in line with the state, but are you willing to work with us to allow more capacity in line with what you're comfortable with, restricting the capacity more so than the state, but allowing us to move away from these crippling capacities that continue to handicap our businesses? Thank you. Sorry, there are a lot of points there, sir.
No, it's good, and I'll try to answer in this way. There's no, I appreciate it. Adrian should speak aloud all the time because his accent is refreshing. In a hollow room that I've been in a year by myself, I appreciate that, and I mean that sincerely. I understand that if I could give you specific clicks of the dial, and I would put up a dashboard and send an alarm to you to say, open up the doors for everything. But I want to be clear, as has been clear by experts, we are not going to go to any massive lift of any restrictions until we have our most vulnerable vaccinated at a minimum, and we understand clearly where these variants of COVID are going. Is it going to uptick? We don't know, but I will tell you what all experts are saying, including Dr. Walensky, who was on the governor's reopening task force, is now the CDC director, saying this is reckless and irresponsible. I can't speak to every municipality, but I do speak with most municipalities as one of the regional leaders. And it's important for context, we understand that most of those communities are just dejected and overrun when you have an administration that gives out conflicting messages. And I am aware that for you, that must be extremely frustrating when not just me, but all of government, when you have this sort of patchwork approach and consistency and don't know what to do. But I also want to be clear that we're fighting the virus, not the business community. And it's the virus that's crippling all of you. And until we get it under control, there won't be consumer confidence. And I'd submit you're not going to get a lot of people back. We are all in to figure this out, but until at a minimum, we know two things. How much of our vulnerable population within the city, how successful be on vaccination. Again, that doesn't mean I have to be vaccinated because I don't fit into one of those priority categories, and justifiably so. And two, where are we? And experts have pointed to mid-April, and maybe we know by before then the variants and any potential surge. Is it happening? Is it not? Does it continue to flatten out or move downward in a statistically significant way? That's it. We find when we when I just want to clarify, when we make a policy decision, there's not one data point, as you all know, and I appreciate you're all cerebral and ask really good questions, and I wish more people would pay attention, as you all do. We listen to a variety of sources and experts, but this is a pretty consistent message across the board, from the CDC director to major health leaders and experts, epidemiologists in Massachusetts, that this across the board lifting of restrictions by the governor is extremely dangerous. There's one statistic we need to keep our eye on. The grade, the measurement for all of us, including me, as I get these calls whenever someone dies, is how many lives did we save? We have the 4th highest death rate in the United States. We're failing by every metric there. And much of it has, I would submit to you, is this patchwork approach. So the best thing and most honest way for me to answer that is when we see those two things I mentioned, vaccines and where the COVID variants are, we have a better understanding. What we're committed to do is to look at some of these other areas regarding outdoor performances and so forth, and other things we can do to help you all. I'm not going to react every time the governor does something, because I'm used to this now, finding out the same time you do, by the way. I don't give a heads up because I would let you know at the same moment. And being prepared to do some of these other things and ramping up. What's that look like when we need to ramp up? I appreciate the question. It's a valid one. That's the most accurate answer anyone can give you. If I give you any other answer, I'm just guessing, and I don't want to do that.
I appreciate that, and you know, the take on it, and I, you know, I also appreciate not wanting to meet with the states reopening guidelines and taking a more cautious approach. Do you consider or support a move or a further move in the current step that we're in terms of step 1 to a more full step 1 rather than the restricted one that we have at the moment?
I would just say to you is we will listen to your input, or whether it's operational difficulties or something that we put forth that you believe you are undermining your ability to keep your consumers or customers or clients safe. But we have to be consistent in terms of what we're doing. We will not do anything to elevate risk, especially around certain types of activities where we know all the facts point that we have super spreaders out of. But if you have input, we're going to listen. We may not agree, but we're going to listen. I encourage you. I'm not going to waste your time. I'm going to listen. I may ask questions, but we are not going to try to massage it to come in line with the state. I do, and I forgot my train of thought. So on that point, I may have to answer it again. I just forgot the other part of my answer. I apologize on that. Yeah, that's where we're at. What was the first part of the question? Not to meet with us. What was the other piece? Yeah, no, what you just said, because it triggered a thought in my mind, and I just got to remember it.
I'm just considering, you know, obviously you're not considering matching the state at the moment, but considering a more full move into phase 3, step 1.
We'd have to look at, you can submit to us ideas. We will meet with you, but I just want to be clear. We're going to stick to where we're at in terms of where these things are heading. If there are activities that can be peeled off that we feel don't undercut that effort and raise risk, we will do it. I just want to say this to you all. We 4th highest death rate in Massachusetts. The governor's approach has been, I'll state it clearly here because I've said it publicly, we can take on the risk because we have hospital bed capacity. That is a good thing to have hospital capacity. I think we would all agree, because if the system collapses, we're left with very unimaginable moral decisions to make, as they did in Northern Italy and parts of the world. But that all guarantees you is that you have a bed to go to, more people get ill and die. And if the governor has one thing that we've never heard, some data to tell us, no, here's all, you know, that explains in better context why the experts are wrong, the CDC director, and why we should do that. For a year now, we haven't heard that, and that because he doesn't have it. But that being said, we want you to communicate with us. If you submit something to us that we believe we can do these things and be consistent and not raise risk, we'll listen to it, we'll hear it, ask questions. If we agree, we'll do it. And if we don't, we'll tell you we don't, and here's why. So I hope that explains it. We welcome the conversation, but I want to be honest and consistent with what I'm saying. That doesn't mean we'll do it, but that doesn't mean we shouldn't have that conversation. If that's fair.
Yeah, I appreciate the offer of dialogue, and I'll get in touch with you after this. That's all we're asking for, is just a dialogue to help us move forward in the right direction. So I appreciate it. Thank you.
Yeah, we want to work with you. We are going to work with you. We know you're invaluable. We know, we're aware. We don't understand because we're not experiencing what you're experiencing because you're running your business. But we hear from you, and I'm aware of that. Just like I hear when someone dies, I hear from you or people around you when you're losing everything you got. And I want you to know that it's resonated with me and every municipal official in the state. That's why we fought hard to get the 668 million from the state, and we want more. So we are aware. I am sorry for what you're going through, and I will give you everything I got to help you through this.
Joe Carrera, I think the mayor answered, I believe, your question, and so did Omar in the chat. But if you feel like it wasn't addressed, please let me know, or feel free to use the raise hand function. We have a question from David Webster from Federal Realty, that you've consistently said that vaccination of vulnerable populations is what's critical. Are you saying that we need full vaccination of the 20 to 49-year-old cohort?
No, I'm not. I'm speaking in general. That'll be guided by our health expert, David. Our most vulnerable people, those who have the highest risk of dying, who are dying at higher rates than you and I and others. We need to understand where we are with that. Right now, you can look at the numbers in the state and they'll say, we're here in the nation, first time vaccinations, second doses, so forth. Yeah, it's true. But when you're starting from less than zero, it's a good place to go. It's like you got an F in a class, teacher letting you make up the work, you're passing in your assignments, taking makeup exams. The bottom line is, though, we're the 4th highest death rate in Massachusetts, and many of those vulnerable populations, like the 20 communities they focused on, and they should, those communities been hit hard. We have neighborhoods in Somerville that aren't getting that access. And they actually abut your project, David, by the way. They have to get the Fenway, and they can't get there. And now they're being told they're gonna have to go to the Heinz Auditorium, Heinz Convention Center, and unless we get an allotment and the ability to run, the administration of vaccinations here. So that's where we are right now. There's not going to be a bright line, and I'm not going to give you that answer because I don't have it. But those are two things: how is our issues on the vulnerable population? Are they being vaccinated, and where are we with the variants? Two important factors I'm going to look at.
Thank you. I don't see any other raised hands or questions. So just to provide some other additional updates in terms of, while we still have our restricted capacities for indoors, the Licensing Commission did expedite the opening date for, or instill an early start date for outdoor seating, starting March 1st. You should have gotten a notification from the city clerk's office. If you were permitted last year using the socially distant layouts that staff has approved, as well as Licensing Commission, you are permitted to install your infrastructure out right now. The only thing that we do ask is that you contact ISD at isd@somervillema.gov for inspections within a week once you put out your furniture. This allows us to sort of stay on top of inspections and not base it off of complaints, as well as make sure that ADA compliancy is met throughout the usage of our public right-of-way. Nick Antanovica is also on the call. Nick, if you'd like to add anything onto that, please feel free to unmute yourself. Outside of existing licenses, new applicants, you still will have to go through the Licensing Commission license amendment application through CitizenServe. Please wait for staff review and Licensing Commission approval before you are out on the public streets, or requesting parking spaces so that you're able to do parklets, etc. So please be sure to follow those regulations so that you avoid any issues with ISD. Again, I will leave the economic development email address on the chat. If you have any questions, feel free to email us, or I can certainly answer questions as well.
Yeah, can we answer Zach Baum's last question? Is there any risk that the temporary outdoor dining will be lost if the governor rescinds the state of emergency declaration?
Sure. Staff is working on changing some of the policy post sort of the COVID world. If he does rescind the emergency declaration, there's a few things that we need to do, including zoning changes, city council authorities, transferring it potentially to Licensing Commission. So it's a streamlined process. We're also hoping that in terms of permitting, we're able to use the same system that we have now and allow you guys to be outdoors all year round. Although with that said, we are going to be a little bit more stringent in terms of making sure the safety protocols are met. So whether that's structural or others, we may need to revert back to architectural stamp plans, depending on where your space is going to be occupied in the public right of way. So, but yes, we are exploring that. We see the benefit of that. And I think restaurants have been able to explore the option of outdoor seating because of this. So we hope to make that a permanent change. Capacity 25% of what was approved outdoors. The maximum capacity of outdoors is basically the space that you have allotted. So if you have one parking space, that's the number of seats we can get in there, assuming that you can put socially distant dimensions. So that's gonna give you the answer in terms of how much you can utilize on the public right of way.
Yeah, Sue, if I can jump in on that, just to clarify, that was correct. And when we go out and when the inspectors are looking at that, that is your approved setup. The 6-foot spacing, as was stated in the chat, meets the 25% requirement on the outdoor seating. So as long as you're setting up with the proper spacing for what was previously approved, that is what is going to be allowed for the setup when we go out there. As Sue previously stated as well, if you do have revisions, just submit those revisions. One clarification for the seating also is that if you do have a revision in for your outdoor seating, if you want to set up the way that you were previously approved prior to getting your revision approved, we will approve the old setup and then you'll be able to just modify to the new setup once it's approved through the licensing commission.
Thank you, Nick. Jessica Asherman for Union Square Main Streets. If questions about data and outdoor dining conclude and we still have time, I have another question. Yes, absolutely. Jess, you can unmute yourself.
Thank you very much, Sue, and thank you everybody for hosting today's conversation. Mayor, thank you for your address on Monday. On behalf of Union Square Main Streets, I'd like to thank you for your service to the city and for the past 18 years, and we very much look forward to working with you through January. I was particularly encouraged by you sharing the addition of a new position in the Office of Strategic Planning and Community Development that will focus on racial and social justice issues in the context of planning, zoning, and economic development. Is there anything else that you can share with us at this time about that?
I will let George and the team, but I do want to add something after that answer. Is George on the call, by the way, or are you taking care of this one?
George is not. Could you repeat that, Jessica?
So I can just say in general on that position is we understand, you know, as we approach as a community to examine every program, every policy to make sure we're truly equitable and we are, you know, eviscerating any form of discriminatory practices, whether even the well-intended programs and policies can have the consequences we wouldn't have imagined because they may not really result in true equity for our community. We know a lot of that is in opportunities and, you know, in our local economy, accessing that economy, who gets jobs, how do we call development, zoning, planning opportunities and so forth. So that is really in a general sense, the high level, the position, Sue on the RSJ, the work, doing the RSJ work in OSP that has been put forth to support the work of the Racial and Social Justice Director, who we hope to announce soon if they accept the position. There is an offer out there. But there'll be more to come on that. If that's okay, I do want to add something else since you were kind enough to mention the speech Monday that is applicable to how we recover out of COVID, if that's okay with everyone. Is that all right?
Yes.
First, I must say, I don't know if the chamber's on the call. I have to give them credit. I got home I gave my speech at 2, got home, 5:10, and there was a big bouquet of flowers on the table. And I was like, who died? And I guess it was me. And but I looked at it, I asked my wife, when did this come in? I was like 2:20. That was pretty fast. So to Steve and everyone, I don't know how you worked that quick because nobody knew. That was pretty impressive. A nice bouquet. Appreciate it. But I want to let you all know, I just gave my notice to my employee. I'm here for the next 305 days. I'm not counting everything I've got. And I tried to stress in that speech is, you know, we need to help everyone heal physically, mentally, emotionally through COVID. We need to get our kids back to where they were, those lost academic opportunities and those highest need students especially who've been, really took it hard, and CTE students and so forth. I have 4 boys too in the Somerville Public Schools, and but I don't understand what a parent of a high needs child is. And we're going to double down on everything on that. We mentioned, and we're going to talk more about it. I'll just speak briefly about the ARC initiative, which is accelerated advance and reinvestment in our communities, the Somerville ARC initiative. And I would try to describe it as this. We know what DIF is when we do district improvement funding. We build a building like in Union Square and Assembly, and the net new tax proceeds from those buildings or that building are used to borrow money to build the brick and mortar infrastructure, sidewalks, roads, utilities. What I'd submit this community needs is now to take that same approach and invest in its human infrastructure. So whether it's high school students who want to go to community college, or members of my community who want to obtain job skills and employment opportunities, whether it's families who need daycare opportunities, or small businesses, as we think about what the Main Street looks in the future, to have to come out of this more stable, recover, or launch new innovation on Main Street, or become a new small business owner here locally. That is what we think about the ARC. And this work's about the launch. And when Jessica, we're going to come to all of you. We're going to need folks to participate in this. So, and the bottom line is that new growth, by the way, the long-term growth and investment is on fire here, will continue. That's great. This is the stuff we planned come out of the Great Recession, but the gap, even though we see high tech, biotech, life sciences coming in, that's great for the overall revenue of the city. It's the Main Street, small business, independent operators that are getting crushed. We know that. I'm aware of that. So I don't think we have. So this initiative is to put in millions of dollars into the human infrastructure of the city for the long term. More to come on that, but I hope you caught that on Monday, and we're going to rely on all of you to work with us and members of our community to design that. That work's going to launch soon. So there's the immediate, how do we get through COVID now? How do we survive? But how do you grow down the road as well? So hopefully that makes some sense, and I look forward to that work with all of you. Thank you. By the way, you got me 305 days. I'm not going to slow down.
With that, I think we have, again, we've got general questions in terms of outdoor capacity and what you can do with tables. I'm going to just speak to it. It's easier than to type it out. The allocated space that you have is based off of your storefront. So the width of your storefront is the maximum amount of space that you can take. That doesn't mean that you can't have those conversations with your neighbors to expand a little further, but staff will review that once you submit your layouts or your site plans, and then we can discuss how we can be flexible around that, depending on the width of your sidewalk or the parking spaces that are there. We've been flexible in terms of bagging these parking spaces, providing 15-minute parking spaces for pickup drop-off. So we're certainly open to conversations about what that looks like. And the capacity is based off of that space, what you have in front of your store. And as long as you're accounting for all of the requirements under HASP and also the socially distant layouts, you should be okay. The last piece that I want to leave off is, as you all know, round 3 of COVID-19 business relief program was extended for businesses facing, issues based off of the government mandated closures, restaurants, businesses, and the new criteria extends it to industries like florists or event planners, nonprofits, gyms, fitness facilities, etc. So please do. The application is online. It is available for submission. And I encourage you to visit the website and submit. If you have any questions, again, email us at economicdevelopment@somervillema.gov. And with that, I want to thank you all for joining us for today. If you have any questions or think of it after the fact, you know where to find us. Please do email us for any follow-up.
I just want to say, we got to get to this last mile together. It's just we need to set the standard on how to do it right. I thank you. I'm sorry for what you're enduring. We're aware of it. We're not going to let you fall off the wayside here. All right. My answers aren't always good for you. I don't have any. I have the best of the worst answers for you. Okay. But I want to make that clear. We are listening. Give us your ideas. We'll work with you. But we've got to keep the safety first. We're going to get there. I promise you. Thank you.
Thank you, Mayor, and thank you, everyone.
Thank you.